Now, can you talk to us a little about the procedure? Later on in the show, we're going to talk. We're actually going to see how the procedures perform. But can you walk us through it?
Absolutely. So the procedure is being done, as I was saying, basically under X-ray guidance, or what we call fluoroscopy. So basically, prior to the procedure, we already have an idea where the fracture is. So we normally order an MRI prior to the procedure, so we know which level is being affected. We normally see the edema or the inflammation around the bone, so we know that that's the level that should be affected. Sometimes some patients, they cannot undergo MRIs because they have pacemakers or other reasons that they cannot undergo. So normally on those patients, we need a CT scan along with a bone scan that will be equally the same as providing the same information as an MRI. So once we have everything in place and the patient has failed at least a couple of weeks of some conservative care, which that means some medications and put them on a brace, and despite the pain is affecting their quality of life, they feel that they're not fulfilling their activities, normally that would be a candidate for a balloon kyphoplasty. So once we have the patient, we brought the patient into the room, we take the consent, with the procedure is being done under sedation. So normally it will be someone who has a colonoscopy, that type of sedation will be the same that is being employed. Then basically we kind of count using the X-ray, so we know already where the fracture is prior with MRI. Normally the area is being cleaned, it's being prepped, and then we do a small incision with a scalpel. And basically, we drive a needle inside the bone. Once we have the needle inside the bone, we use different views to make sure that we're in the center of the bone with the instruments. And then we go ahead and we do a small channel inside the bone where the balloon will go.
I saw that balloon in that photo, just like that.
So the balloon, what it does is basically does a reduction of the fracture. So normally the fracture is going this way instead of being a bone like this. So the reduction, what it does is just to try to restore the height again. Okay. Then the balloon is being deflated, so we remove the balloon out, and then we inject the cement in the vertebra to harden the fracture.